Tail, like.
The head sits in the lap of the duodenum. Here's the duodenum. The head sits in the lap. And then the tail is in contact with the hilum or the opening of the spleen.
A duct which is, comes from head.
The duct? Oh, the duct of Bourassaum, the main duct.
Bourassaum.
Main duct is duct of Bourassaum. And the accessory duct is in the head, and that's the duct of Santorini, S-A-N-T-O-R-I-N-I, duct of Santorini.
Bourassaum is W-I-R-S-U-M-G?
That's correct. And that's the main pancreatic duct.
Okay.
And those are all test questions. Here's a view again showing the tail in contact with the spleen, and here is the head of the pancreas sitting in the lap of the duodenum. And when the duodenum has fluid, you can see the C loop that is with anechoic fluid. On the ultrasound, we rely on what's not shown here. Here is the head of the pancreas, here is body, and here is tail. Let me see if I have a better view showing of this one. Here. The splenic vein lies on the posterior border of the pancreas. And here is body, here is tail, and here is head region, but head is not clearly defined. This is a poor image of the pancreas in terms of the head. You like to see where the head ends. You like to be able to trace where the head ends, because the head is very commonly involved in adenocarcinoma. So you always worry about the size of the head. You want to measure the head. So when you're documenting the head, you want to be able to trace, well, where does it end? Where does it, you're able to trace the head. Another view of the pancreas, aorta, IVC, superior mesenteric artery, and here I can trace where the head is. So when you're looking at the head, not only are you concerned about size, maximum of 3 centimeters, you want to look at configuration. So even if the body and tail are narrow, and then you come into a head that's a little bit bulky, you should be concerned. You're looking at both size and configuration. Size and configuration.
What's normal measurements for the head?
The head should measure more than 3 centimeters.
No, no.
Some books may say 3.5, but most books will say 3 centimeters. You can also see the pancreas longitudinally. You can see sections of it. Well, how do I know what section of the pancreas I'm looking at? Go back to the anatomy. The IVC is on the right. The aorta is on the left. So if I'm looking at IVC, then I'm looking somewhere near body of pancreas, towards body head region. If I'm aorta, then I'm somewhere near the tail. Here is the inferior vena cava. Here is a section of the pancreas. So if in inferior vena cava, I'm on the right, I'm somewhere near head body region. If I'm aorta, I'm somewhere near tail. Is that point understood?
Mm-hmm. But.
Yes.
Okay, say that one more time, please.
Yes, here's IVC. Here's part of the pancreas. The question is, where am I in the pancreas? Am I head, body, or tail? Well, if I'm seeing IVC, I have to be somewhere over here on the right.
Okay.
So I'm somewhere near body to head,
Okay.
somewhere in that region.
Mm-hmm.
The pancreas is more echogenic than the adjacent liver. In older patients, 2 things happen to the pancreas. It shrinks or involutes, so it becomes smaller in size. It also becomes replaced with fat, so it becomes more echogenic. So in older patients, the pancreas is smaller and more echogenic. It becomes smaller and more echogenic. Here is the left lobe of the liver, transverse view. Here is the splenic vein. Here is a pancreas that's considerably echogenic. You see that? So the pancreas changes with age. It also becomes more echogenic in certain disease conditions, which we will talk about later on. So the echogenicity of the pancreas is generally moderately echogenic in younger patients, moderately echogenic, but slightly more echogenic than the liver. And as we age, as we get older, it becomes smaller and more echogenic. The slides say four major areas. Some would say combine neck and head as one area. So head, neck, consider one area, body, and tail. Oh, let me just what you were talking about that yesterday. There was an extension, a medial extension of the pancreas called the uncinate process. That's what you're talking about?
Yes,
Oh, okay.
I knew we
Okay.
had the boot thing. The boot.
Oh, because we call it the boot?
Well,
Alright, so
it
the
doesn't matter.
uncinate process is an extension of the pancreas. The gastrointestinal artery can be seen anterior to the pancreatic head as an echo-pore structure, anterior to the pancreatic head. I think I mentioned yesterday as a variation. Sometimes you can see it right up against, it looks like it's within the pancreas. Mm-hmm. Again, because of the section we're getting and the GDA coming down, you may sometimes see it as if it's within the pancreas. Same for the common bile duct. Mm-hmm. You will generally see it posterior, CBD, posterior to the head of the pancreas. Sometimes you may see it within, because at times they may travel within the pancreas in a groove. The GDA, you may often see it anterior, and sometimes you can see it as that as well. So there are variations in terms of how you see the structures. That's on everybody's test as well. Everybody's. Body and tail. Head. Should measure less than 2.5. Again, as I said, some books might say 3.5. The measurements of the body and tail are less important. However, as I said before, you want to look at the configuration. You want to have a head and body, as a head and tail, that's proportional to the head. Proportional to the head. If the body and tail is nice and thin and narrow, and then the head bulges, something is wrong with that configuration. There are two pancreatic ducts. The main pancreatic duct is called the duct of Wirsung. The main pancreatic duct, it extends from tail to head. Duct of Wirsung. It joins the common bile duct and inserts into the duodenum. The pancreatic duct should not measure more than 2 millimeters. Underline that number. Pancreatic duct should not measure more than 2 millimeters. The duct of Santorini, a secondary duct, we almost never see this, and there are no normal numbers for it in ultrasound. But you should know what it is and where it's located. The vessels, well, you've seen them before. The splenic artery supplies the body. Venous drainage, it is drained by the superior mesenteric vein and the splenic vein. These measurements are not important, so don't memorize them. Physiology, and then I'll stop here. The pancreas is both an exocrine and an endocrine gland. Anybody know the difference between an exocrine and endocrine gland?
And the inside, no? And
Yeah.
within.
Close. And the endocrine gland is called a ductless gland, in that the secretion goes directly into the bloodstream, as opposed to an exocrine, where it relies on a ductal system to get it into the body. So as an exocrine gland, the pancreas has acinine cells having ducts which allow the secretions of pancreatic juice to get into the digestive system via these ducts. So as an endocrine gland, the pancreas secretes pancreatic juices. which gets into the intestines via the pancreatic duct. That's the exocrine function, using ducts.
Ducts. Okay, so
Main pancreatic duct joining the common bile duct.
So they allow for the excretion,
yeah,
pancreatic juices?
Yes, they conduct pancreatic juices from the pancreas into the duodenum via this duct system, the main pancreatic duct. That's the exocrine function. Secretes pancreatic juices, which gets to the intestines via the duct, the exocrine function. In those pancreatic juices, there are a number of things that aid in digestion. Don't memorize these. Trypsin, amylase, lipase. Collectively, they break down proteins and fats and carbohydrates. That's the function of the pancreatic juices, digestion. Again, don't try to memorize these enzymes. You should just know that the pancreatic juice contains enzymes for digestion. Just as an aside, we'll expand on it when we talk about pathology. What happens sometimes is that these pancreatic juices escape from the duct and they begin to inflame the pancreas. And that's what causes pancreatitis. But we will expand on that when we get to pathology. As an endocrine gland, the secretions go directly from the exocrine islets of Langerhans into the blood system. There are two types of cells, alpha cells and beta cells. The alpha cells secrete glucagon, and more important, the beta cells secrete insulin. Alpha cells, glucagon, beta cells, insulin. There's also delta cells that secrete growth hormone. So the pancreas, as an endocrine gland, ductless gland, secretes alpha, beta, contain alpha, beta, and dental cells. Most important are the beta cells secreting insulin. Most important is the beta cells secreting insulin. The important lab tests are the amylase and the lipase. Important pancreatic function tests, amylase and lipase. When they are elevated, they very often indicate inflammation. So patients with pancreatitis, for example, would have elevation of the amylase and the lipase. Glucose elevation is patients with diabetics. But in patients with pancreatitis, the amylase and the lipase are elevated. All right, I'll stop there. All right, so this is a very important weekend for you. There is a lot of reading about pancreas, and there is test mode preparation for the upcoming final. Read and study the entire chapter on pancreas. Next Monday and Tuesday, we finish the pancreas. Wednesday, we will review pancreas, and then we'll do a general review. Okay, and then the following Monday will be the big one.
Good night, everybody.
Good night. You should bring 2 Red Bulls to class that night.
I don't know, that might be dangerous. I think I'll stick to one.
Good night.
All right, good night.